Hey everybody, welcome back to another episode of Regen Med podcast. I'm here with Dr. Abraham and my name is Lindsay. And today we are going to talk about something that's really popular right now, PRP, platelet-rich plasma.
I love that topic.
You do.
I love PRP.
So being that it's something that's it's been around for a little while, but I feel like now people are just getting into it, doing the research on it. But there is a difference between PRP and there's the advanced PRP and I guess your regular, we'll call it PRP. So really, what is PRP and what are the differences between the two?
Yeah, so PRP is very commonly used in many areas of regenerative medicine. PRP stands for platelet-rich plasma, and it's usually, depending on which type of PRP we're doing or what we're treating, but it's usually going to involve using a patient's own blood to take away the platelets, concentrate them in what we call platelet-rich plasma, and then using that in the treatment. So I guess very briefly, when we look at somebody's blood, there's the plasma, which is the liquid that contains all these cells and all the proteins. You have the red blood cells, which is one of the main components of your blood. And the red blood cells deliver oxygen to your tissue. So basically, when we're doing PRP, we're taking the blood, we're taking the red blood cells and throwing them away, unfortunately, because we don't really need them for this. And then what we're taking, we're looking specifically at certain cells called the platelets, and we are basically concentrating that platelet in the plasma, which is why it's called platelet-rich plasma. So we're taking a large amount of blood, but then we're throwing a lot of it away, and we're just keeping a little bit of plasma that's really highly rich in platelets.
And they call it, what do they call it? Liquid gold? Something like that? Because it's like a golden color.
Yeah, it's usually like yellow gold color. So one of the names that people will refer to is liquid gold because it's precious.
It's very precious.
Yeah. You can do a lot of great things with it. So that's what PRP is, and it has regenerative properties. So it's used in skin rejuvenation, for example. It's also used many times in joints for people who are suffering from joint issues, joint pain, ligament, tendon issues. Many times it can be useful in these areas. It's also used for hair rejuvenation. It's used for many, many different purposes. So that's kind of what PRP is. You were mentioning different types of PRP. There are different ways to... Not all PRP is created equal, let's just say that. There's different concentration of PRP, and that can play a big and significant role in the effect. So that's one way to differentiate PRP that we can go a little bit more into. And then there's things that can be used along with the PRP. So like something like A2M, for example, which is concentrating certain proteins in the plasma and adding them to the PRP to make it a little bit more advanced. So there's a few different ways to make PRP.
Enhance the...
Exactly.
So with, I guess, regular PRP and advanced PRP, it's just a concentration level difference between the two?
That can be a big part of it, because basically when again, let's say we're starting with 50 cc's of blood, and then we're taking 5 cc's of that liquid gold, that yellow stuff.
Mm-hmm.
The amount of platelets that's in there, because the platelets are these, we're going to think of them as these soldiers that are going to go in and help prepare the tissue, help rejuvenate the skin. So obviously the more soldiers we have, the better, the stronger they are going to be. The bigger the army that we have, the better, the stronger that it's going to be. And that is a part that varies a lot. I think that's one of the, I guess my pet peeves about PRP is many people do say that they're providing PRP services but are not really aware of the different concentrations, and that makes a big difference. Again, if you're going with let's say, just for example, with 1.5 times the concentration of your original blood, or 2 times the concentration, versus if you're going in with like 7, 8, or 10 times the concentration. You have, at 10 times you have, 5 times as many platelets as you do at 2 times the concentration, right? So the amount of platelets makes a big difference, and it can be, sometimes how effective the PRP is, that is a huge factor in it, right? So that's one of the most important factors in it, I would say, and it's one of the most overlooked factors. And I think that's partly why sometimes you see, certain PRP treatments that people will do, and maybe it doesn't work, but then when we do it with a more advanced or with a more concentrated actual solution, they're gonna have a completely different experience, because again, you're attacking that joint with small army versus a very large army. And
and it gets confusing, I think, also because people will say like, oh, my friend did it didn't work for them, and I'm like, oh, well, okay, everyone's different. And they go, oh, well, they also only paid like, $200 or something. And I'm like, well, okay, they probably didn't even get platelet rich plasma. And I think there's also the PPP, which is
platelet poor plasma. I mean, all these play a factor, right? People will say, well, my friend didn't. And it's like, okay, well, what did your friend do it for, and what was the issue, right? When we talk about joint pain, there could be 100 different things more than 100 different things that are causing joint pain. So you want to talk to somebody who can really figure out what's causing the discomfort. And again, that's just one example. And figure out if you are, a candidate for PRP or not. You don't want to be just doing it blindly, just like any other procedure. So that's the first thing. Because maybe in a certain case something different is better, but also again, it comes back to exactly what you said. People will come in and they're like, they think they've done PRP, but again, if they have no idea what kind of concentration they were getting, and maybe they were getting 1.5 times the concentration, which again, many times is not going to be like effective at all. And honestly, from what I've seen, more often than not, many places are doing kind of the lower concentrations because it's cheaper, and it's
repeat visits.
It takes less time.
Injections.
So I mean, again, not to there are different ways to do things, but definitely with PRP, you want to make sure that you are going to a place where they can give you the best quality of the PRP, because that can make a huge difference. So PPP, as you mentioned, which is a funny name, I think, PPP, it's platelet poor plasma. So when you take that blood and you kind of throw away the red blood cells, and you're not automatically left, let's necessarily, with platelet rich plasma all the time, right? Because if that plasma can either be platelet rich if it's concentrated, or it can be platelet poor, but the problem is they both look the same, because the platelets don't give color to the plasma, so they all kind of look similar. And if somebody doesn't know what they're doing, or if they don't have the right tools, they just see the yellow stuff. It's like, oh, it looks yellow, let's just inject that, thinking that they're injecting platelet rich plasma. And again, I'm not talking about patients, I'm unfortunately talking about providers who sometimes will do that mistake. But that's why it's important to have a very to have the right processing in place and the right tools, because a platelet poor plasma is plasma that is platelet poor, so it doesn't have a high concentration of platelets, so you're not getting what you're looking for. And I've seen that, we do a lot of trainings, so we go like to clinics and we see what the people are doing, and we're teaching, and people come to us, and I see it all the time. I see people injecting platelet poor plasma all the time, thinking that they're injecting platelet rich plasma, and patients getting platelet poor plasma thinking they're getting platelet rich plasma.
And then on I guess on the back end, to differentiate platelet poor to platelet rich, is it just a different processing of the blood? Is it a different system? Is it?
Yeah, that definitely plays a big role, right? That's why you wanna go to a place you can trust, where people have experience, and people had the proper training. They know what they're doing, and they have the knowledge. It's something that they do. It's not just something that
specialize in.
Exactly, something that's specialized in, because again, it's easy to make that mistake. with the providers. Yeah, because the processing is very, very different. And it can be like you can't just look at it and just be like, oh, this is platelet rich versus platelet poor, right? So, uh, as a patient, you have to be in a place again where you can trust, because you're not going to be able to just look at it and be like, this is platelet rich. I can tell you some of the wrong things to look at, right? So, because these are the things that people say all the time, and I don't know if I'm gonna get too technical, so you can stop me. But like one thing you mentioned, usually, the price. It's not necessarily the cheapest isn't always better in this case, right? It doesn't mean that you have to always pay the highest price, but like again, a lot of times, cheaper isn't always better, right? Mm-hmm. The other thing is, the larger the quantity of plasma that's given is also not always better. A lot of times. Mm-hmm. You can get like 2 cc that's much more concentrated, and it's going to be way more effective than like 5 cc that don't have any plasma in them. So if your provider is kind of boasting about like, oh, we can get like 10 ccs of PRP, that's probably more of bad. Like, out of 20, we can draw 20 cc's of your blood, and we can get 10 cc's of PRP, so we'll give you more PRP. That's probably a bad thing, because you're probably not going to get like a very highly concentrated, because again, it's like the amount of platelets that they're drawn out is limited, and you want to concentrate them, you want to put them in as almost like as smallest quantity as possible. Mm-hmm. So just having a larger quantity in of itself isn't a good thing. Now, doesn't mean that just get 1 cc is better, because then they might be giving you like 1 cc of platelet poor. So it doesn't, again, I'm not saying that the lowest is always the better, but for sure, don't just go based on like, oh, like, well, this place is going to inject me 3 cc versus this place is going to inject me 10 cc, so it must be better. Because again, it's we have that much blood. It just, we want to throw away the bad stuff and just give you the good stuff. If we're giving you all the bad and the good and it's all mixed together, then you're not going to get the same benefits. So those aren't like the right things to look at.
And then also, I think it's just important for people to just be educated before they go in to do these types of procedures, and saying something like, what is the concentration of your PRP? Is it 9 times standard? Is it 5 times more concentrated? Like, yeah. What am I getting?
And if the provider can't answer that question for you, they're like, then that's that might be bad sign. And if they're like changing the topic to tell you like about other stuff
about how much you're gonna get. Oh, I'm gonna give you 10 cc's. You're gonna be good, and you're just like,
exactly.
Red flag. maybe red flag. We don't know.
Yeah, but it's a topic that that's part of the reason I love that topic, is because I really believe PRP, when done right, it can be very, very useful, very beneficial, very helpful to the right clients. But it is one of the things that's, I see it all the time being like not done properly, and and then again, you're not going to see the results that you would have seen otherwise. But yeah, and also just kind of again knowing how knowledgeable your provider is, how comfortable they are treating whatever you are, getting treated, whether it's a joint or whether it's a rejuvenation treatment, like you said, something that they do all the time. Those are, I think, important points to look at,
especially for people that are doing something like joint, which it's repairing tissue, and like you really do want that really high concentration for something like that. And to think that someone's going to get something that's not very concentrated in an area like that, and it's not the most comfortable treatment. It can be a little bit like a sting, painful injection, and multiple treatments of that, like people going more than 6, 7, 8 times with this low cost, and not seeing very good results with it. It's just very costly, and it wastes your time. So it's important, I guess, to emphasize the difference between the different types.
Yeah, it's a waste of time, and again, you're gonna think it doesn't work for you, and now you might have to go to the next step when there was a solution maybe that you just kind of missed out on, which is honestly I think it's the worst part of it. And I think also like just having all the other tools in place, would also, be helpful. Like whether in some cases having imaging like an ultrasound or other stuff. So, sometimes these things can give you a little bit more of an assurance that this place, like maybe they know what they're talking about.
Oh yeah, the ultrasound guided treatment. Yeah.
Yeah.
But yeah, well, that's good to know. And hopefully this can help someone out there and kind of just shed a little bit of light on PRP since it's becoming so popular. I feel like every med spa and everyone's doing it. And like you said, not all PRPs are created equal. So to be cognizant of that.
Exactly. Be cautious. Again, ask about the concentration of the PRP you're getting. You can ask them about the types of processing that they're doing, specifically like the type of centrifuge, and then you can go and look it up yourself and see is that something like like they might say M-site or Apex or something like that, and then you can go and be like, okay, what is that something that if I do some research on it, is that an actual legitimate company that is an advanced first rate service, company that does this procedure, or is that just something that's new that no one knows
And
about?
also to add to that, like, these treatments are not inexpensive. They can be expensive. And so if you're going to invest that money, I think it's important to do that extra education, extra background work to kind of fact check providers as well. I mean, not everyone's going to tell you, honestly, like the truth. They're going to tell you what you want to hear so they can get money sometimes, which is sad. But I find that people are sitting there doing the research, and then when you give them the information and they're able to do that research, and then they go, you're right, I did see this and this and this, and then they can make that really good choice for themselves to where they can trust you. I mean, everyone trusts you, and they're very confident that they're getting the best of the best. And that's just because we're being very transparent with this type of thing, and I think a lot of people are not.
Yeah. No, it starts with the provider honestly doing their homework and doing the proper training, doing the right thing to make sure that they're providing the best quality, and then that's when you can transfer that information to the client so they can make the best decision. But I think as a client you have to be asking the right questions. You have to sit down with don't just go anywhere and be like, just do it. Sit down with them, talk to the provider, ask them a question, whatever questions you have on your mind, and get a feel to how they respond, and if there's anything unsure of, then
and even call like a couple different places and say, all right, this person said this person said that, and then you can kind of say, well, this person said this over here and you're telling me this. So that's a good way to kind of see.
And again, especially with PRP, because PRP is almost hurts me, but it is a treatment that I think is can be a great treatment, and can be potentially very helpful to so many clients. And I hate to see clients again not getting the results because they are not getting they think they're getting PRP, but they're really not, or they're really not getting any quality PRP. They're getting very lowly concentrated PRP, and you just can't compare the two. You can't compare, just like anything else. Again, think of anything with concentration, anything with number. You just can't compare it when you have a very low number and a very high number, but you're just calling it PRP in both cases.
Yeah. Well, I feel so educated now. So that wraps up our podcast for today. And just, I guess, keep in mind that there are different types of PRP out there, and to just do your research.
We didn't get to talk about like A to M on some of the other ways you can make the PRP even more, more advanced, I think is the word you mentioned, but we'll get to these in a different
A to M.
episode.
Alrighty.
All right.
Bye. Have a good day.
Take care.